everyone, and thank you so much for joining us here at our Proficien webinar series. We're very grateful to have you briefly for 30 minutes at most this afternoon as we discuss quantifying clinical risks, as well as how to address these risks with the Proficien platform. Just to lay out some of the technicalities, just a reminder that the session is being recorded. So if you can please stay on mute on your devices. And if you have any questions, please just message us in the chat box. So my name is Caleb. I am a paramedic by profession. I've also been doing a lot of postgraduate studies and research, primarily in the emergency medicine space. So that's my area of expertise, I suppose, and which is quite relevant because, as you can imagine, in emergency medicine, there are plenty of clinical risks that can occur. Currently, I'm involved primarily in education and training, research, as well as some healthcare consulting work. And what I'd like for us to cover just briefly this afternoon is quantifying clinical risks, strategies and solutions for risk mitigation, as well as the role of Proficien in these risk mitigation strategies. But before we dive into these topics, we would love to just hear from you. And we've got a brief pre-webinar poll. If you could just scan this QR code with your device, there's just 2 questions there on any clinical risk challenges that you have in particular, as well as what tools you are currently using in order to mitigate these risks. So I'll just give a brief minute or two just for you to scan that QR code and answer those questions. And while you are doing that, also just a special word of thanks to Tricia, who is assisting us in the background with these webinars. Well, thank you very much for that. That poll will remain open. So to start off with quantifying clinical risk. And I suppose the first thing to say here is that it is important that we do quantify risk. Not only to give us a snapshot as to how our companies and organizations are currently performing, but also to measure the impact of our risk mitigation strategies. We have to know how we are doing currently, and we have to have a baseline to measure against for any clinical risk mitigation interventions that will be performed in the future. And there are many ways that you can quantify this risk. We've listed 4 primary ways here, but there are, of course, many other ways and various combinations of methods as well. So we can look at malpractice claims against our companies. We can look at what those are for, what the reason is behind them, as well as the associated costs that go with that. Ideally, an adequate risk mitigation strategy will decrease the costs that risks carry. So that's one way of looking at it, looking at those historical type records. We can also look at various patient safety indicators, and these are well researched. There are many indicators with good research behind them in many different spheres of the healthcare system. And so we can see how we are performing in our organization against these indicators. Then we can also use compliance and audit scores to see how we are doing, as well as various, and there are numerous incident reporting systems. But the key method or the key takeaway here is that no matter which method you're using or which combination of methods you're using, that is a good thing, and it should be done as a starting point to ultimately mitigate risk. In terms of solutions for clinical risk, there are many, and we've listed a few here. But there are data-driven skills and risk assessment tools that we can use, such as digital skill scorecards. You can see those in the corner here, as well as digital validation tools. There are various forms of centralized risk dashboards that we can use. There is simulation-based risk training. And there is even in South Africa, currently a lot of research going into simulation-based skills training as well. So that is really on the rise here in South Africa, and it's such an important way to mitigate risk. There are, again, various patient safety indicators and monitoring those. And also, and this is a really big one, just optimizing clinical workflows and communication. It is amazing how much risk occurs simply because organizations, companies, and people within these various organizations are not communicating well. So just improving workflows and communications will go a long way to solving our clinical risk problems. Now, when it comes to mitigating clinical risks, one of the problems that we often have in healthcare, especially I would say in South Africa, but this is likely the case abroad as well, is that a lot of our methods of mitigating risk tend to be retrospective. In other words, the risk has already occurred, the damage has already been done as a result of that risk. The medical legal lawsuit has already been filed, and the costs have already been paid in damages. And that is unhelpful, because what happens is then we look at that and we say, okay, how can we quickly fix that problem? And it's not a very proactive approach to clinical risks. And so what we like to focus on at Proficien is certainly a proactive strategy to mitigate risk through education and enhanced clinical practice by the providers at the front line of patient-facing care. So with Proficien, the solutions that we offer to clinical risks are our Proficien platform, which can be seen on our website, as well as downloaded as a mobile application. We offer clinical governance consulting services, software development services, and data analytics as well. And what that really helps us do is exactly what we've spoken about on the previous two slides, is to first identify and quantify what the current risks are, and then develop solutions to those specific problems for your organization through our various other services. Within the Proficien platform, the primary features that we are operating with are a skills tracking function and educational activities. And this skills tracking function essentially acts as a skills log. So for example, if you are a provider and you have placed an IV line on a patient, you can log that skill within the skills tracking function of the application, and that's at a touch of a button in your pocket on your mobile device. And you are then awarded a skills currency, and the way that works is that if then you go 1, 2, 3 months without placing another IV line, your skills currency will decrease, and the application will remind you that it is time to refresh on that skill to keep you current. And it will then guide you to an educational activity regarding that specific skill, in this case, an IV line for this example. And that's a way of keeping practitioners current, even in skills that they perhaps don't perform very often. We know that all of our skills carry various risks, and those need to be mitigated. And education is a primary tool that we can use to mitigate those risks. We also know that a lot of the skills that we perform relatively infrequently are quite high-risk skills. So if we start thinking about more complex, rare skills in your various environments, those tend to be even higher risk than the normal skills that we perform day to day. And so it's even more important that we keep up to date with those through educational activities. We then also offer a continuous medical education platform on the application, and we're quite excited about this. It's a new product that we have, or that we'll be launching within the coming weeks. And this allows providers to gain CPD points, again, at the touch of a button, through various high-quality courses, through various partnerships that we are developing. And that allows them to stay compliant with healthcare regulation, as well as improve their own clinical skills and get those CPD points that they need. Another very exciting thing about this platform is that it allows companies and organizations and even individuals to upload their own educational activities. So if you have educational content that you would like to offer and provide, you can put it on this platform. And you can do that in such a way that it's for the world to see, or it can be just within your organization. So if your organization would like to make use of this platform as an in-house training facility, that can be done as well. And so, again, our main aim with the Proficien platform is to proactively mitigate clinical risk through improved clinical practice and education. So when we begin working with an organization or a company who is interested in these platforms that we have to mitigate their clinical risk, we begin with a needs assessment. We sit down for an initial consultation to assess the specific needs that your organization or your company have. And based on those needs, we don't want to just offer a generic solution. We want to tailor make the solution to your context. And that's quite important. And so based on that initial consultation, we will develop a proposal and then send it to you for review. And once that proposal is agreed upon, the intervention can then be implemented. And that will be through various combinations of the Proficien platform, our consulting services, and software development based on your needs. Then we will reevaluate that intervention. We like to walk a journey with any clients that we have, and not just simply dump a check sheet on you, because we recognize that clinical risk mitigation is an ongoing process. It's not a matter of checking a box and now you can say your clinical risk is mitigated. No, there is an ongoing process of evaluation and re-evaluation and development that occurs, because the healthcare system, as well as the risks associated with healthcare, are also continually evolving and adapting to change. And so we like to take part in that journey with our clients. So we will reassess, we can add additional interventions, tweak the system based on your needs. And then as new features become available on the Proficien platform, these will be made available to you as well. If you would like to find out more about Proficien and the services that we offer, please go ahead and download the application, visit our website at proficien.com, and get in touch with us directly. I'll be happy to set up a meeting with you at your convenience to discuss these issues further. So with all of that being said, more than happy to take any questions. If there are no specific questions, we would also like to just finish this brief webinar with a post poll. And we do this just to get a good idea as to what healthcare providers are currently struggling with, what the challenges are, and so that we can see how we can best meet those needs. So please, again, 1 or 2 minutes just to finish that poll, and then we will say goodbye from there.